Since 2010, New York state law has actually mandated that everyone between the ages of 13 and 64 be offered HIV testing at least once. The reason that they passed that law was really to get in line with recommendations that have been around since 2006, when the Centers for Disease Control and Prevention revised their recommendations about HIV testing. So instead of targeting people for testing based on their perceived risk factors that they would have HIV, they realized that many people with HIV were being missed by that strategy. And so rather than targeting people that you thought were at risk, the idea was to offer to everybody, no matter what you thought their perceived risk was. It's a real challenge. It's been a real challenge to implement expanded testing in the emergency department and other settings. The emergency department is a place where people come in that can potentially be very sick. It's a very busy environment, and performing a screening test was not necessarily at the forefront of many of the emergency department providers' minds. You can look at it from multiple perspectives. I guess it's hard for providers and nurses to implement something that's really more of a public health focus. So to increase screening for HIV in the emergency department is not what the most emergency department providers and nurses would think of as their primary mission. And so it's been hard to get sort of buy-in from that group of people. And as far as patients, there is some resistance because it's generally, there is still some stigma associated with HIV. And so some patients may be surprised when they're asked the question of whether they'd like to be HIV tested if they come in for something that is very likely completely unrelated to HIV. And so it's been a process of trying to normalize the offer of testing and trying to normalize the idea that everyone should be offered HIV testing and hopefully accept testing. No, you must obtain consent, either from the patient or, if the patient is unable to provide consent, from somebody that is legally allowed to make medical decisions for them. No, HIV sort of stands out, has a legacy of what's called HIV exceptionalism. Almost any other test, we don't need to obtain specific consent before performing that test. It's just that it's understood that it's part of the routine medical workup that patients are undergoing when they, present to a medical setting. But for various reasons, mostly historical at this point, HIV remains an exception, and that's been a real barrier to overcome. There is definitely a movement to change that, but it's a very entrenched, the feeling that there's something different about testing for HIV is really entrenched, both in the minds of the medical system as well as among patients. I think that the sort of notion of HIV exceptionalism has persisted because HIV is very bound with certain social factors that I think a lot of people have had a hard time separating the infection itself from the social associations that they have with it. We have done our best to routinize testing both in the emergency department and in the inpatient settings. For one, by just having it offered every time, doing our best to have it offered every time people present for care. We have posters up that explain that this is the law. People are not that it's the law to offer them HIV testing, so that people don't feel like they're being singled out and they're not as surprised when they present to the emergency department with a broken arm and they're asked if they want an HIV test. So it's sort of there are public health campaigns to try to normalize it from the patient perspective, and as far as working it into workflows for the emergency department and the inpatient setting, we're doing our best to make it sort of as unobtrusive as possible. People that work in the emergency department or work on inpatient units have protocols for how they deal with intake of patients, and we're doing our best to build in the offer and performance of an HIV test into those protocols, so it's not something that providers need to go out of their way to accomplish. One of the key ways that we've found to help routinize it is to integrate it into the electronic medical record. So a lot of what emergency department providers and nurses do is interacting with the electronic medical record as they're ordering tests, as they're thinking about studies. And so we've tried to make changes to the electronic medical record to remind providers and nurses that an HIV test should be ordered, and we've tried to simplify carrying out that order so that at the end of the day it's actually performed.